VIVA stands out. As a not-for-profit organization, we try to give the best, latest scientific data on our therapies for our patients.
The thing that draws us all here, both audience and faculty, is passion for the treatment of vascular disease.
Our entire mission is on education, research, and helping people work and collaborate together.
I think it also brings together all members of the healthcare team. It creates a family, and that cohesiveness increases communication and quality outcomes for patients.
I think VIVA truly gives the opportunity to learn from the best in the world in a format that people get along and get to share their ideas very closely.
VIVA combines all of the fun, exciting things about our profession. It allows us, first of all, to network and be around each other. It allows us to meet other people from different specialties in the multidisciplinary approach. It allows us to be cutting edge. It allows us to watch how other people do things.
I'm passionate about VIVA because it really is the centerpiece of medical education in the vascular space. It engages all the specialties equally. It's vascular surgeons, it's radiologists, it's cardiologists, it's vascular medicine.
We all want to be part of something, and I think it allows us to really develop the best care for the patient in the future.
Every year is different for disruptive technologies. The half-life of medical knowledge when I was first training was 5 to 10 years. Now it's 9 months. We have to continue to increase our technologies to give patients easier, less invasive, safer, and more effective therapies. And that's where we start.
The late-breaking clinical trials are literally hot off the press. You have to see this because these are the trial results that are going to go directly to your practice and are going to introduce new devices to the market.
The fellow and resident sessions at VIVA, I think, really add a lot to the overall content that we have at the meeting. And the goal of the sessions that we have tailored specifically for fellows are to really address a lot of the needs that fellows have and the unanswered questions as they make the transition from trainee to practitioner on their own.
The reason VIVA Live cases are different is that we really identify cases with high teaching quality. The different centers are showing different types of cases to make sure that the audience gets a very broad exposure.
I think it's really important that we have made the change to include the nurses and techs in the general sessions for several reasons. One is we're able to allow the nurses and techs to be exposed to the latest procedures, techniques, and treatments for patients with PAD.
It's all about moving the field forward. We are forward-thinking physicians, and they want to be part of it. They want to get swept up in the VIVA movement.
VIVA is one of the most exciting and interesting ways to continue your education out there. So if you're thinking about a conference to go to for your CME, this is the one to go to.